It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
All right, coming up next is Dr. Amir Abdul-Jabbar. He's an orthopedic surgeon from Swedish Neuroscience Institute. Lumbar stenosis. This doesn't sound like anything to mess with.
Nothing to mess with. This is a situation where you have bony growth in your spinal canal that's compressing on the spinal cord, which causes severe pain, neurological symptoms, a real issue for a lot of people out there.
All right, Dr. Abdul-Jabbar and Shannon O'Kelly.
Dr. Abdul-Jabbar, welcome to Health Talk. How are you today?
Doing well. Thank you for having me.
Thanks for joining us. Tell our listeners about your practice. You're an orthopedic surgeon with an emphasis in spine care, but tell us about your practice.
Yeah, so I'm one of the orthopedic surgeons with Swedish Neuroscience Institute, and I specialize in spine. We cover all different kinds of spine care, from the very simple to the very complex. So that's what we do.
How did you become interested as a surgeon, particularly orthopedic surgeon, in the spine? I know you go in medical school and all of a sudden you're going, hey, I like this area. This spine's pretty cool. What grabbed you about the spine?
Well, in orthopedics, we deal with every major joint in the body, everything outside of your brain and your chest and abdomen. So we see it all, and the spine is where it all starts. It's all connected there, and it's all interesting to me, but the spine is one of the most complicated, as I said, and thus the most interesting.
Not only complex area, but also a sensitive area. I mean, if you think about it, the spine houses our spinal cord, and each one of those levels, as you go down those vertebral levels, there's nerve roots going off, and so that nerve tissue is very sensitive and extremely delicate, and you're working in an area correcting bony dysfunctions to eliminate stress or pain or compression on a nerve or a muscle or limb part of the body.
Yeah, it can be a bony compression. It can be a soft compression from a ligament, or even disc material is a very common thing that we see. So there are lots of different ways that the nerves can be affected, and we deal with all of them.
Okay, we're going to talk today about spinal stenosis. I mean, a term that describes a narrowing of a canal. Let's talk about it in the spine from a spine perspective, cervical, thoracic, and more lumbar stenosis.
So as you said, it can affect every part of your spine, and it can affect the spinal cord, it can affect the nerve roots in the canal, and it can also affect the nerve roots as they're exiting. So anytime that you have squeezing or narrowing, we call that spinal stenosis, and it can affect you in all different ways, from having pain, having weakness, and then also can even affect simple things like your bowel or bladder function.
I mean, it's a term that describes, like you said, compression. Almost, I mean, a simple thing is like taking a hose and squeezing it, and you eliminate or you decrease the water. And on a spinal cord and nerve tissue, when it gets compressed, it causes symptoms, and that's sometimes pain, radiculopathy, paresthesias. Maybe you can describe compression on a nerve root or the spinal cord. Maybe some symptoms. We'd see unilateral, bilateral symptoms, etc. It's kind of a complex area again.
Yeah, we could talk a long time about this, but the spinal cord, when it's compressed, that's probably something up in your neck or the thoracic spine, has a very different set of symptoms compared to a nerve root when it's being compressed. So when it's your spinal cord, it can actually affect your walking, and it can affect your hands, your dexterity. When it affects your nerve roots, it can create more pain symptoms, more weakness as you actually compress a nerve that may be going to function of your ankle. Then you'll have a foot drop possibly, or you could have pain coming down the side of your leg into your foot. All these different things can be different presentations, and so that's what makes spine care a little bit more complicated, but very interesting. And again, you said it's very sensitive tissue, so even a small amount of compression can cause quite a bit of symptom.
It's an amazing area. Now, stenosis, what do we know causes it? I mean, it's kind of a wear and tear, kind of an aging thing. A lot of times we talk about the aging process, but I mean, is your body depositing calcium in that spinal canal, or that canal that the spinal cord runs in? Or are there other tissues that grow into it? Is it scar tissue? What is the root cause of stenosis, and who gets it? More male, female? What age range? Let's talk about those things.
There can be some more rare symptoms or causes of stenosis, but the most common is just general aging. We're pretty familiar with hip or knee arthritis, and you kind of get bone spurs and things kind of compress along those edges of the bone. Because we have 3 joints in the spine, it can compress from 3 different sides. So you have your facet joints in the back, the disc in the front, and those can come together, and as you get more arthritis, that squeezes in on the joints, and that's the most common explanation for it.
More with Dr. Abdul-Jabbar coming up next on Como.
It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
More with Dr. Amir Abdul-Jabbar and Shannon O'Kelly right now.
Well, Dr. Abdul-Jabbar, spine surgeon, orthopedic surgeon, thank you so much for joining us, and thank you for sharing your insight on spinal stenosis. What we know now is that it's a kind of a degenerative condition, the arthritis or some kind of compression on the spinal cord in the spinal canal causes symptoms, could be numbness, weakness, et cetera, down in either extremities, arms, or legs. Tell us about diagnosing it. Tell us about the symptoms. How does a patient present, and what are you going to do to intervene?
So presentation can be difficult to parse out. Some people have back pain, which is just common across the board as the starting symptom. Some people may have no back pain and they present primarily with leg pain. So sometimes you won't think of your spine when your symptoms are mostly in your legs. It can be weakness, it can be pain, it can also be numbness or tingling coming into the legs or arms depending on where the stenosis is.
Would you say in your experience it's more of a 60-year-old plus, or can it happen in is there a particular time in life where this is more prevalent?
It's more common in older patients. As we do more in life, it's normal to have a little wear and tear of your joints, and as we get older, that accumulates over time. But we do see it in younger patients as well. Some people have a genetic predisposition to arthritis, and we see that in patients in their 30s.
And a lot of times people describe certain positions that they like to be in or positions they're uncomfortable in.
Absolutely. The spine is a very dynamic set of joints, foundation of your body, and getting in different positions has a lot of effect on the room for the nerves.
You're going to get most of your information on a good history and physical, but from a diagnostic standpoint, do you have a favorite? Is an MRI with contrast, just to really identify the stenosis?
The soft tissue is usually the major component that creates the stenosis. Again, we said it's arthritis, it comes from the bone, but it's also ligaments that can be hypertrophic or larger than they're supposed to be. And to see that, we really need an MRI, and we usually get one without contrast as kind of a basic screening exam. Some people can't get MRIs. They may have clips in their brain or pacemakers, and then there's actually a CT scan that's done with dye called a CT myelogram that can give us that same information, a little bit more invasive.
In medicine, we like to grade everything. It seems like we have a grade for every condition. Is stenosis one of those that you grade it based on the compression or the space occupied in the canal, so to speak?
We do. It's kind of a judgment call, and our radiologists are really helpful. We call it mild, moderate, or severe.
Yeah, there you go. Yeah.
And, it's different to every set of eyes that looks at it. But when you see enough of it, you can tell mild, moderate, severe have a very different spectrum in terms of the way they look, but also in terms of their presentation in the patient.
And what about treatment options for the most part?
So most part, we try to do things non-operatively. You can actually get some little bit of relief with just physical therapy, and increasing your activity level can help to alleviate some of that pressure. But when it gets to a point when it's too severe, we do surgery to remove that soft tissue in the bone spurs and create more room for those nerves.
And what about outcomes in that condition? People return to pretty functional activity 4 to 6 months?
Sometimes it can be very quick, even quicker than that. It does take time to heal after surgery, absolutely. But some people, if they have a severe stenosis, you can decompress those nerves and they're up and they're better walking within a week or two.
Well, Dr. Abdul-Jabbar, thank you so much for your time. Great information. Thank you for joining us.
My pleasure to be here. Thank you.
All right, that's been Dr. Amir Abdul-Jabbar, orthopedic surgeon from Swedish Neuroscience Institute, swedish.org to get more information. That's something that I guess is not real common, Shannon, but something certainly to be aware of.
It is something to be aware of, and situationally, I mean, you have to have it looked at. It can be treated, and you can relieve a lot of pain.
Final segment right after this time out on Como.